Sure. Okay. So Dr. Anderson is going to join us shortly. So we will move his presentation to the third presentation, and we'll move on to our next presentation, which is stress and anxiety in irritable bowel syndrome patients as a consequence of the COVID-19 pandemic, a systematic review and meta-analysis. So we have three speakers that are authors on this presentation. So we have Miss Salma Memon. Salma is a first-year student at St. George's University School of Medicine. She obtained her MPH with an emphasis in global health in 2020 from Loma Linda University School of Public Health, and her BS in health biology in 2018 from the University of California, Merced. She is an active member of both the Medical Science Research Institute, partaking in research under the mentorship of Dr. Ramdass and Dr. Montalbano, as well as a member of the Lambda Epsilon Alpha Medicals Honor Society. So our next author on this talk is Dr. Ramos-Nino. She is currently works at the Department of Microbiology, Immunology, and Pharmacology at St. George's University. Her current research interests include inflammation and association with chronic diseases, off-label use of drugs prescribed in chronic diseases, infection disease vectors and their potential reservoir, and water-based epidemiology to monitor community spread of pathogens and health factors. And our final author on this presentation is Dr. Prakash Ramdass. He is an associate professor of clinical epidemiology at St. George's University School of Medicine in Grenada. Dr. Prakash Ramdass is the track director for epidemiology in the MPH program at St. George's University School of Medicine. He lectures clinical epidemiology and biostatistics to year 2 medical students and public health research methods to MPH students. He received his MBBS from the University of Guyana School of Medicine, his MPH in chronic disease epidemiology from Yale University School of Public Health. His research interests include irritable bowel syndrome, endometriosis, and women's health. So very happy to turn the floor over to Ms. Memon.
Yes.
Okay, perfect. Thank you. Okay, so good afternoon. My name is Salma, and I'm a first-year medical student at St. George's University School of Medicine. Today, I will be talking to you regarding the role of psychological distress in irritable bowel syndrome patients during the COVID-19 pandemic. Just before I get started, I would like to thank Dr. Ramos, Dr. Ramdass, and Dr. Mitchell for their contributions on this presentation as well. Irritable bowel syndrome, or IBS, is a type of functional gastrointestinal disorder often characterized by repeated bouts of GI symptoms, including, but not limited to, abdominal pain, bloating, changes in bowel movements, and flatulence. It is estimated that 1 in 10 people are affected globally with IBS. However, symptoms often go overlooked or underdiagnosed by physicians. According to a report published in the American Journal of Gastroenterology by a team of doctors in the United States, providers fail to diagnose up to 75% of individuals with IBS, or in other words, 3 in 4 people. Certain criteria, including Rome criteria for IBS, in addition to ruling out other GI disorders, may be used to diagnose an individual with IBS. Although the exact etiology of IBS is unknown, it is believed that the disorder is multifactorial in nature, with brain-gut dysfunction, dysmotility issues, and increased visceral hypersensitivity secondary to inflammation, all predisposing individuals to developing IBS. Psychological distress, including stress and anxiety, are known to exacerbate IBS symptoms, likely due to, again, increased overactivity of the GI tract. Prior to the pandemic, a large number of patients with IBS suffered from psychological distress. Estimates show that over 37.1% of individuals living with IBS suffered from depression, and another 31.4% suffered from anxiety. It is no shock to us that the COVID-19 pandemic negatively impacted many individuals worldwide. According to the World Health Organization, COVID-19 associated anxiety and depression increased by over 25% globally. We wanted to better understand the impact of the COVID-19 pandemic, specifically on IBS patients. And that is why the aims of this review were to estimate the prevalence of COVID-19 among IBS patients and to determine the association between IBS and psychological distress symptom severity during the COVID-19 pandemic. For this review, 4 databases, including Embase, Scopus, PubMed, and Google Scholar, were searched using the keywords IBS, COVID-19, and SARS-CoV-2. The search was limited to original articles published between January 2020 and to September 2022, which yielded a total of 176 articles. A title and abstract review was done by 2 reviewers, and then full texts were retrieved and assessed to see if they met our criteria. Duplicates as well as non-original studies, including but not limited to reviews, abstracts, and conference proceedings were removed, in addition to any articles that again did not meet our criteria. 29 studies in total that met our criteria were included in this review, and a total of 8,021 patients were reviewed. The first aim of this review was to estimate the prevalence of COVID-19 among patients with a confirmed diagnosis of IBS. According to these 7 studies listed on the screen, the pooled prevalence shows that a 5.8% of patients with IBS tested positive for COVID-19. It is important to note that the pooled prevalence may not accurately reflect the true number of individuals with IBS who tested positive for COVID-19 due to several factors, including limited access to test kits in countries during the time period that the studies were conducted, individuals not presenting to their physicians for testing, or asymptomatic cases which may have gone undetected. Interestingly enough, several studies specifically looked at individuals with no prior history of IBS or any functional gastrointestinal disorder, and then the number of individuals who developed IBS following infection with COVID-19. Current data suggests that around 10% of people who are infected with a bacteria leading to bacterial gastroenteritis will develop IBS, with disease duration and symptom severity as the main factors that result in an individual's increased risk of developing IBS following infection. Similarly, the studies listed on the screen suggest that IBS can develop in individuals with no prior history of the disease following infection with COVID-19, given the GI manifestations associated with COVID-19, including nausea, vomiting, abdominal pain, and diarrhea. Using criteria in line with Rome 4 criteria for IBS, Blackett and his team found that in a hospital in the United States, 44% of individuals developed IBS following a COVID-19 diagnosis. However, one limitation of the study was that they only looked at symptoms at 3 months following COVID diagnosis and did not follow up with the typical 6 months needed to diagnose IBS using Rome 4 criteria. Furthermore, Blackett and his team also mentioned that in a subset of the patients in this New York hospital, they analyzed they may have had lingering symptoms from COVID-19 rather than a true post-infectious IBS. So the estimates for symptom prevalence may not be as high as the 44% we see here, since some of those lingering symptoms may just decline with time. So extended follow-up must be warranted. Again, this makes sense given new data emerging that are long COVID diagnoses. In another study done in the Metropolitan Hospital in the US, they also found that over 21% of the individuals studied developed IBS following infection with COVID-19. Interestingly enough, Velez and his team conducted multivariable adjustments in this sample and were able to find that a previous history of anxiety was associated with incident-like IBS symptoms following a COVID diagnosis with a 95% confidence interval. They further found that among these new onset dyspeptic and bowel complaint patients, there was a significant correlation between psychological distress and GI symptom severity. These findings are in line with what our data is revealing in another study where we are looking at the incidence of post-COVID IBS in patients with no prior history of the disease. Initial data findings from the meta-analysis conducted suggest that about 20% of people with no prior history of IBS are developing post-COVID IBS. It is important again to note that further research is needed to determine if there's a causal relationship between getting diagnosed with COVID-19 and developing IBS, and assessing the relationship between the characteristics of individuals more likely at risk of developing this type of post-COVID IBS. Given the wide range of presenting symptom severity in COVID-19, further breaking down the data to better understand how COVID disease severity plays a role in post-COVID IBS may give us a better understanding of how to best address these patients. Continuing on the second aim of this review, we wanted to better understand the impact of the pandemic on IBS patients in terms of psychological distress, including stress and anxiety among this population. Several studies show that anxiety levels were higher among patients with IBS as compared to those individuals without IBS. This was in line with what was seen in Japan and France, where researchers found that the hospital anxiety and depression scales for anxiety specifically, or our HADS assessment, showed significantly higher scores among IBS patients compared to their non-IBS counterparts. In France, Sabate and his team also found that women with IBS actually showed higher HADS scores compared to males in their study. In Bulgaria, using the Generalized Anxiety Disorder Assessment, or our GAD-7, Nakov similarly demonstrated higher levels of anxiety among individuals with IBS, and that anxiety was related to increased GI symptoms. Another study done in the US also found a correlation between psychological distress and GI symptom severity in our IBS patients. Interestingly, though, in Italy, a team found that only anxiety, not stress, was significant for supporting the worsening of symptoms in IBS patients, including increased abdominal pain and epigastric burning. However, it is important to note that in their study, they did find a significant correlation between anxiety levels and perceived stress levels. So it is likely corresponding to the data previously presented that psychological distress may again be associated with worsening of GI symptoms in our IBS patients. Although data was limited about information regarding IBS in our pediatric population during the COVID-19 pandemic, one study conducted in the southeastern US found that children between the ages of 8 and 17 with a mean age of about 13 experienced lower rates of anxiety and a better quality of life during the pandemic, which is quite surprising given what we see in our adult patients with IBS. All of the aforementioned studies point towards this idea that adults with IBS experience more psychological distress under the COVID-19 pandemic and experience worsening of GI symptoms. Besides anxiety, several other studies also exhibited that IBS patients experienced more stress during the pandemic. In Saudi Arabia, researchers found that 63.4% of individuals with IBS showed stress levels, with the majority of individuals reporting that their fear of a family member contracting COVID, fear of self-infection, or death due to COVID infection were the most common causes of their stress. In addition, they found that the coexistence of chronic comorbidities was another cause of stress in this population. In France, similar findings suggested that patients with IBS thought they were more at risk of getting COVID-19 and for experiencing a more severe infection compared to individuals without IBS, which was contributing to their higher stress levels overall during the pandemic. We understand that the pandemic has negatively impacted many individuals worldwide. From the data seen in the studies, including in this review, irritable bowel syndrome patients were undeniably affected by the pandemic, experiencing worsening GI symptoms and higher levels of psychological distress compared to individuals without IBS. In addition, there seems to be a link between psychological stressors disrupting the gut-brain axis, predisposing individuals to the development of IBS following a COVID diagnosis. There were several studies that showed some individuals with IBS actually experienced symptom improvement during the pandemic. In Japan, researchers hypothesized that some of these IBS patient symptoms improved because of the decreased work stress they experienced from now working from their homes and having lower commuting times, because again, they were working from home. This could also be associated with individuals having greater access to different things they may need to manage their disorder at home, like easier access to the toilets and medications readily available. As we saw earlier, as we saw earlier with our pediatric population, those researchers hypothesized that pediatric patients may have had improved symptoms, not only because of decreased stress of not having to go to school, but also because they were in close proximity to their parents or caregivers who can monitor and check on their symptoms. Another team in Singapore also found that during the pandemic, individuals with IBS reported feeling less anxiety and less lonely and had more quality support systems during the pandemic, which may have been associated with symptom improvement. Other studies similarly showed stronger support systems and marriages were associated with less worsening of GI symptoms. Lastly, resilience was identified as another protective factor during the pandemic for our IBS patients, since researchers hypothesized that patients with IBS were already used to living with higher levels of psychological distress, just having to cope with their disorder. So that may have helped them deal with the additional stress inflicted during the pandemic. Although further research is warranted to compare our pre-pandemic to pandemic psychological distress levels in our IBS patients, these studies suggest that IBS patients had a higher symptom burden and experienced greater psychological distress during the pandemic compared to their non-IBS counterparts. Not only is it important for physicians and individuals living with IBS to manage the GI symptoms associated with their disorder, as we saw here, also addressing the psychological distress, including the increased anxiety and the stress level seen in our IBS patients, should be a factor highly considered in their disease management. In addition, increasing social support systems may help reduce symptom severity and decrease symptom burden in our IBS patients from high stress events like the COVID-19 pandemic. Thank you for your time.
Thank you. Okay, want to ask if there are any questions in the audience, and if you have any questions online, please put it in the chat. Okay, let's see. I have a question for you, Salma. So it sounds like, just to clarify, it sounds like the mechanism of COVID-19 causing IBS might be that the psychological stressors from COVID-19 activate the HPA axis leading to IBS. Is that correct?
So just to clarify, a lot more research, most of the data that we had seen was not really tied to if they showed if COVID was diagnosed before the IBS, or IBS was like a result of their, sorry, let me backtrack. Was the IBS diagnosed as a result of the pandemic stressors, or was the IBS diagnosed as a result of the actual diagnosis with COVID? And so that's kind of where those gray areas of the research falls in. And so hopefully people will be able to study this a little bit more in depth to understand if it really is the psychological stressors making people more predisposed to having IBS, or if it's the actual COVID disruptions in the gastrointestinal manifestations for developing IBS.
Okay, great. Thank you for clarifying.
Thank you.
And let's see, and then just one other question. Do you have any suggestions for unique interventions to address psychological distress in patients with IBS? I think we all can think of some interventions for people in psychological distress, but wondered if there's anything unique in that population.
I can get back to you on that question, just because I am only a first-year medical student, so I don't have a full understanding of the correct interventions used for psychological patients. But from the studies that we had seen, a lot of people just mentioned things like reducing stress levels through exercise. Yoga and meditation was another big one that I had seen. But again, because my background is not well versed in that, I don't feel comfortable fully answering that.
No problem. Fair answer.